Welcome to this video. The first subject we're going to look at is asphyxia. Now, people use the term asphyxia in different ways. Some people define it as an inability to breathe or a blockage between the outside air and the alveoli. Other people will give it a much broader definition. So, for example, if the blood is unable to carry oxygen, they will call that asphyxiation. Or if the tissues are unable to carry oxygen, they will, unable to utilise the oxygen, they will call that asphyxiation. So one useful definition might be a state of acute hypoxia, low levels of oxygen in the tissues. Perhaps the most common cause of asphyxia that you'll come across, though, is an inability to breathe, choking. So let's consider what happens during the process of suffocation. So in suffocation, if the air cannot get in and out of the lungs, then clearly the amount of carbon dioxide in the lung will rise and the amount of oxygen will fall. Thinking about the alveoli here, the oxygen will be absorbed into the blood and carried away. Carbon dioxide will be dumped from the blood back into the lungs, and if there's an obstruction in the airway, then oxygen falls, carbon dioxide rises. And of course, clearly, this is going to have a knock-on effect on the arterial blood. Now, when we're talking about blood gases, we use this suffix here, the P, before the gas. It's short for partial pressure. So what it means actually is that the amount of oxygen, the percentage of the gas load of the blood that is oxygen, will fall. So the amount of oxygen in the blood will fall in the arterial blood. And of course, the amount of carbon dioxide in the arterial blood will rise. Because the cells of the body are metabolizing, producing carbon dioxide, dumping it into the blood. The cells of the body carry on using the oxygen, but this is not being replenished from the lungs. Therefore, the oxygen falls and the carbon dioxide rises in the arterial blood. And of course, this has a carry-on effect to all the cells of the body. So in all the cells of the body, the amount of oxygen will fall as it's used up, and the amount of carbon dioxide will rise. So in acute hypoxia, let's say there's an acute hypoxia. The patient becomes acutely hypoxic. In this case, it's due to a disturbance in the, it's due to a blockage in the airway. And of course, this is very distressing. The patient becomes very distressed. There's nothing worse than not being able to breathe when you need to breathe. But if the suffocation continues, the patient will become unconscious. They will lose consciousness because the brain runs out of oxygen supply. Unconsciousness will occur. And of course, if it's prolonged, then obviously this is a life-threatening condition. So suffocation will lead to acute hypoxia, distress, very distressing, then unconsciousness, then death. And the amount of carbon dioxide, the amount of oxygen will fall, that is hypoxia, and the amount of carbon dioxide will rise, and the term which describes high levels of carbon dioxide is hypercapnia. Hypercapnia. So the effects of suffocation. The patient is asphyxiating, these things will happen. Let's now think about possible causes of asphyxia. And the first one we're going to look at are possible traumatic causes. So causes of asphyxiation those caused by trauma. Well, if there's maxillofacial injury round about the jaw or the top of the neck, then there's a possibility that local edema will occur, and this can partly occlude the airway, or indeed, in principle, fully occlude the airway. So the patient is physically unable to breathe in and out. And this can be a particular problem with scalds and burns, especially with inhalation injuries. So if the patient has inhaled very hot air in a fire, the inside of the mouth and the upper airway is burnt, this swells and can completely occlude the airway. And very often, to prevent this inflammatory swelling and subsequent occlusion of the airway, these patients have to be given steroids to reduce that swelling. Anytime there's compression of the windpipe, compression of the trachea, so after hanging or strangulation or any pressure on the trachea, can lead to asphyxiation. And sometimes, actually, related to this problem, there can be a problem after surgery on the neck. So like if there's any bleeding, for example, after thyroidectomy, any bleeding into the neck can cause pressure on the airway. And as well as that, sometimes after a thyroid gland's been removed, the trachea, the alignment of the trachea can be altered, and there can be like kinking of the trachea. So very careful observation of the airway is necessary after any neck surgery. So anything which can affect the airway directly, for example surgery or external pressure, strangulation or hanging, possible causes of airway occlusion, therefore asphyxiation. And if there's injury to the lungs or the chest, for example a pneumothorax or fractured displaced ribs or stab injury, then there may be a physical defect in the ability to ventilate due to injury to the chest. And blunt trauma may cause inflammation and pain, and indeed pain can limit the amount to which people can breathe. So direct injury to the chest. So a few traumatic causes of asphyxiation. Now perhaps the most common cause of asphyxiation is a foreign body in the airway. Inhalation of something as simple as a boiled sweet can block off the trachea. So any obstruction to the airway. For example, this pen lid that I'm using, if you inhale that could lodge in the trachea. That's why there's little holes in it. And you can actually breathe in and out of those little holes if a child or someone were to inhale it. So any foreign body in the airway, perhaps the most common cause of acute asphyxiation. So thinking about foreign bodies, anything there which should not be there, of course, is a foreign body. And these can cause partial or complete obstruction of the airway. Very distressing condition for the patient. Very often they'll grab the throat. And of course, if there's complete obstruction, they won't be able to breathe. So the patient might be agitated, clasping their throat, but unable to speak, unable to ask for help. There may be blood or vomit or other material in the airway. And indeed, this is a common cause of death in people that have taken overdoses of drugs or indeed alcohol. They drink a lot of alcohol, they become unconscious with it, and they lie flat on the back, they fall flat on the back. And while they're lying flat on the back, they vomit. And of course, next time they go to breathe in, the mouth is full of vomit, and they inhale the vomit down into the airway and can asphyxiate by inhalation of their own vomit. So very important for anyone that is unconscious, regardless of the cause, to be nursed in the semi-prone position. So if they vomit, gravity will tend to allow the vomit to flow out of the mouth, so it will not be inhaled. So any blood or foreign material in the airway.